Hi, Joe Flower here. Today's topic is when ideology trumps arithmetic. So everybody over there in libertarian land is all over Bernie Sanders, again, about healthcare, again. But this time they have a study, and the study says, whoa, holy moly, Sanders' Medicare For All plan is going to cost $32 trillion. Yes, trillion with a T. That's astronomical. That's unbelievable. But I'm sitting here with, wait, what? Okay. It turns out that's for 10 years. There are different versions of Bernie's Medicare for All or single payer. But basically, all these versions are saying, take all the ways we pay for healthcare, private insurance, out of your own pocket stuff, state and local governments, scoop them all into the federal government and pay for them with taxes. The libertarian types are saying, oh, look at that. That's a lot of money. That's a lot of taxes. Yeah, it's a lot of money. But it's money we're already paying. In fact, it's less than we're already paying. Because the study authors accepted Sanders' guess that Medicare for All could pay for doctors and hospitals at something more like today's Medicare rates than private rates, could push down drug prices, could cut out the extra 10% or so that insurance companies use up in administration, advertising, profit. Because today, this year, in this country, the best guess at how much all of this healthcare is costing us is $3.7 trillion. Now, extend that out 10 years. Add 5.5% inflation, which is the government's best guess at medical inflation over those years will be if we don't do something drastic. You don't get $32 trillion. Or even $37 trillion, which would be 10 times today's figures. You get almost $48 trillion. So saying that Sanders' Medicare for All plan would cost $32 trillion is saying it would save a lot of money. But libertarian land is obsessed with government power and taxes. Corporate power, private power, all other kinds of power just don't count for them. They aren't on the radar. Coercive costs, and what is more coercive than health insurance? It can literally be your money or your life, just don't count if they aren't taxes. Take all the money we're paying now through our own premiums, our employer's share, out of our own pocket, convert all that into taxes instead, and it's freakout city because, oh my Lord, they are taxes now, and taxes are evil. What the study really says, right there in its own numbers, is that healthcare would cost less under Sanders' Medicare for All plan. Taxes would go up, but premiums, deductibles, copays would all disappear for everybody. But once again, we have another round of the argument about who pays for healthcare in this country, in what way, that never asks the question, wait, why does healthcare in this country cost twice as much as it does for people in other countries with worse results and still not cover everyone and still make it a big gamble for everyone? What are we doing differently that makes our system cost so much? Isn't there something we could do to make it cost less? Cut out the massive waste, take better care of everyone who really needs it, and stop draining resources from you and me and the folks down the block? Stay tuned. We've got some answers.